For this video, I wanted to reiterate the concepts of window and leveling as it relates now to a CT chest. So the Huntsfield unit table that's associated here definitely is important because that's going to help us with our level. So remember that our level or our brightness is related to the structure that we're trying to be able to visualize. So when we look at these manipulations that are going to take place as we see the changes in window width and window level, think about this HU table once again. So negative 500 corresponding roughly with the lung. And then you can see some of the tissues. So for example, the heart is an example of a muscle. So it has a positive value that's going to be associated with it. So keep this table in mind as we kind of go through the manipulations that are going to take place within this given video. So what we're going to see first, we're going to look at essentially the mediastinal window for this CT image data set. And we're only going to focus on the axial orientation initially. So kind of to look at it and kind of to break it down, let's go from the superior aspect. So we're not able to see any of the lungs. We can see a little bit of the clavicle here, but you know what, we're not quite into those lung-based structures as we kind of go down. Notice that the window width is set at 500, then the window level is set at 50. So again, think about those muscles. We're trying to visualize the muscles and structures that are associated with the heart. So we're going to need a window level that's relatively consistent with that structure. Window width just pertains to the amount of grayscale. So we don't have a completely narrow grayscale. We do have kind of a mid-level grayscale in that we have a large amount of grays that are still associated with it. It's not 5,000, it's not 2,000, it's not a ton of grays, but it's also not 50-50 is being set there. So it's kind of that middle balance here. So as we kind of go through the apices of the lungs and work our way more inferior into the body, you can see some of the vessels, the vasculature structures that are associated or link up to the heart, and we can see the structures of the heart. We can see the aorta. We can kind of see those divisions that are taking place here at the pulmonary vessels. We can see the structures of the heart, the chambers. They're all nicely visualized within this particular window and level that's established here. But what's not visualized well are the structures of the lungs. Okay, so we can see some structures that are associated with the lungs, but we're seeing a lot of blackness that's associated with it. The rationale is because our level is not set appropriately. So what I'm going to use for this particular video is just use the defaults, because the defaults are pretty consistent. So I want to be able to say, let's visualize the lungs better. Notice what happens though. Now our window width has subsequently expanded. We're utilizing a lot more grays here, but also our window level has changed dramatically because we're now required to be able to visualize the structures and the vasculature and the vessels that are associated with the lung. And instantly you should be able to see that. You can see those branching based structures here that are feeding respective areas. To be able to oxygenate the blood and be able to send it and distribute it out throughout the rest of the body. So this is of course the inferior aspect. So this is inferior to superior. So let's go back up to the apices here, and we're able to see those apices. Of course, when you look at it this way, now we're no longer able to visualize the structures of the heart very well. So it is a balance, and this allows a radiologist to quickly assess those given structures, but nonetheless it's really cool to be able to see the vasculature that's associated with these lungs, and essentially understand better how the blood returns to the heart and then feeds through the lungs, becomes oxygenated, returns back to the heart, and is pumped out through the rest of the body. But nonetheless, just in terms of just the concepts of window and leveling, hopefully this is now reiterated for you. Just to go off of defaults to kind of further convey the concept of what's really going on. So say that we want less grays, so we want more black and white. So I'm just going to get rid of a 0 and show you how dramatic this change is going to be. All right, look at that. We have a lot of very high contrasting structures within, this now visualizing within this data set. So essentially all of the structures either turn black or white respectively. So say that, instead of 1500, I'm just going to go in the midpoint. Let's go with 750. you're still able to visualize the structures of the lungs, but you're not nearly at the level of detail that we saw before. It's just too contrasty still between those blacks and whites. So in order to prevent it from being too contrasty, let's just go back to where we were and be able to see the difference here. So of course, now back to this true visualization here, back to that window and level that we can see those lung-based structures. You can see the difference there. Just to kind of go back to the concept of the mediastinum now, you can see that manipulations within this data set here is also going to make a difference. So intraventricular septum is visualized there. So let's say just, what does small, subtle manipulations do? So 450 versus 400 versus 350. So in essence, we're getting smaller and smaller, and we're getting less and less grays respectively for each of these visualizations that we're seeing here. So it's a balance. So we have to be able to see the appropriate amount of grays to be able to see the structures of interest, but also the level has to be set towards that structure of interest as well. So again, hopefully between the combination of videos between the chest and the head, that these concepts are now nicely reiterated for you.